Warning signs in newborns for mothers and caregivers. Most babies grow and thrive with no problems at all. Sometimes, young babies do get sick, and signs of illness may not be obvious. They can get sick very fast, especially in the first days and weeks of life. This video will show you examples of 10 warning signs to look out for. If your baby shows any of these signs, take him to a health worker right away, day or night. This can save your baby's life. Trouble feeding is the first warning sign. The baby with trouble feeding sucks less or poorly, or not at all. He may not open his mouth when offered the breast, or he doesn't act hungry. The baby may not stay awake long enough to empty the breast, or may not even wake up to feed. Here is a healthy baby. She is alert and suckles well at the breast. Less energy is the second warning sign. Babies sleep a lot in the first weeks of life, but they wake up to feed every few hours, and they are alert when they are awake. A baby with less energy than normal will look sluggish and drowsy. She may sleep longer than usual and even sleep through feedings. Try to wake the baby. Clap or rub a foot. Notice that the baby with less energy doesn't wake up easily. Here, we compare a normal sleeping baby. When we try to wake him, even just by clapping, he reacts normally by fussing and crying. And then he stays awake. The baby with less energy doesn't wake up when aroused. Less energy and poor feeding often overlap. Fits are the third warning sign. Fits are abnormal movements in a young baby. They may not be very obvious. You may notice an abnormal staring look, blinking of eyes, or unusual movements of the lips. Or fits may be more obvious. In this baby, we see abnormal tightening of his feet and jerking of his arm. A cold body temperature is the fourth warning sign. Compare the baby's body temperature to your own. If the baby's belly and feet feel cold, the baby is too cold and may be very sick. Warm the baby quickly by placing her on the mother's bare chest and cover them with blankets. The baby will warm up, but if she still looks unwell, this is a warning sign. A hot body temperature is the fifth warning sign. The baby's body will feel hot to touch compared to your own body. The baby's mouth may feel hot on your breast as he feeds. His face and body may look flushed. Cool the baby off by removing his clothes briefly. If the baby is still too hot or looks unwell, this is a warning sign. Trouble breathing is the sixth warning sign. If your baby breathes too fast or has a rocking motion to the chest and belly, he has a serious breathing problem. Here is a baby breathing normally. his chest rises and falls quietly. Compare this baby to a baby with a breathing problem. Here's another baby with a breathing problem. This baby is breathing much faster, and his chest and belly have a rocking motion. Watch closely. As the baby draws a breath, his chest draws in, and the belly appears to move out. Jaundice is the 7th warning sign. Jaundice is a yellow coloring of the skin and eyes. Check for the yellow color by taking the baby outside and pressing firmly on her soles. Here, we compare a baby's sole without jaundice to a sole with jaundice. If you see a yellow color on the baby's soles, this is a warning sign. Umbilical redness is the 8th warning sign. A moist cord with redness at the base of the cord is often the first sign of an umbilical infection. It can become serious quickly. The redness can spread. There can be swelling, pus discharge, and a bad odor. The baby's belly may also swell. Skin pustules are the 9th warning sign. Light yellow pus-filled bumps on the baby's skin are a sign of a skin infection. The pustules can spread over the body and grow in size. The baby may show other warning signs, such as poor feeding and lethargy. Red, swollen eyes with drainage are the 10th warning sign. In a serious eye infection, the baby's eyelids will appear swollen and red with yellow pus drainage. When it's very serious, the eye cannot be opened fully due to swelling and pus. If you see any of these warning signs, bring your baby to a health worker right away, day or night. Keep her fed and warm during the journey. Remember, young babies can get very sick very fast. Remember the 10 warning signs: trouble feeding, less energy, fits, too cold, too hot, trouble breathing, yellow skin, or infection of the cord, skin, or eyes. If your baby has any of these signs, bring her to a health worker right away, day or night. Getting care in time can save your baby's life.